My name is Danelle Serrano. Imagine having to have a life-saving surgery that would require the use of a blood transfusion, but due to either your religious beliefs or your body's inability to handle outside blood, you have to turn the surgery down and basically suffer to death. Unfortunately, until recent years, that was pretty much the case. But thanks to doctors and other medical field team members, they found a way to practice bloodless medicine and surgery. Today, I want to tell you guys a little bit more about bloodless medicine and surgery, what it is, who practices it, what are the techniques that are used, and what are the benefits of choosing this type of surgery over the common surgery techniques that we have. First, I want to tell you guys about the basics. Bloodless means without blood, which is pretty much what the surgery is, except, yes, you do bleed during the surgery, but they don't take any outside blood, any stored blood, and do blood transfusions within the surgery. It's basically an alternative route to practicing medicine. According to Spartanburg Regional Healthcare System, in the early 60s, they had the first doctor who performed a successful heart surgery without the use of a blood transfusion. And since then, they've been working on expanding that practice to any and all surgeries that require blood transfusions. The people that commonly choose this type of surgery are Jehovah's Witnesses, who believe in their religion that it is a sin to have outside blood be put into your body, or patients whose body will reject the blood even if it is the same blood type, which usually causes more complications than it does good in most circumstances. Now we know who practices it, so how do they practice it? Second, I want to tell you guys about the common techniques that are used in these types of surgeries. According to the Bloodless Medicine and Surgery program at penmedicine.org, before surgery it's very important to take in enough vitamin C because that will help to absorb more iron, which helps to transport more oxygen to the red blood cells. Also, before surgery, of course, it's important to not take blood thinners and to avoid drinking and smoking as much as possible. According to an article in CBS News, they also use iron transfusions and natural hormones to boost up red blood cell count in pediatric patients, so that way when they go into surgery, they don't have to worry too much about the patient bleeding out. And also, they do ultrasonic scalpel, which is where it uses ultrasound waves to cut through the body's tissue, while at the same time, it seals off blood vessels, so that way you don't bleed out. And laser surgery, because that reduces the amount of blood loss as well. Now we know the common surgery techniques, so why is this practice making such leaps and bounds in the medical field? Lastly, I want to tell you guys about the benefits. According to the Center for Bloodless Medicine and Surgery at johnhopkins.org, the most important benefits are quicker recoveries, which means shorter hospital stays, which means it's more cost effective to the patient and to the hospital, and less risk of infections, which means less stress to the patient and more comfort for them to be in their own home quicker. In conclusion, bloodless medicine and surgery is opening the door for new medical procedures. What started out more for religious reasons has opened the doors for surgical medicine with the new techniques by boosting red blood cells before surgery, by reducing the amount of blood that's lost during surgery, and helping the patient to have less risk of infections and recover quicker after surgery.